my name is Steve Winter, and today I did a journaling article from the Journal of Sports Physical Therapy about the effect of static stretching of the calf muscle tendon unit on active dorsiflexion range of motion by James W. Udas et al. Pretty much the main question in task today, or the clinical question, is: does static stretching have an effect on flexibility of the calf muscle unit measured by active dorsiflexion range of motion in healthy adults with a wide variety of age in healthy adults in a 6-week trial? So the subjects were 89 adults. They had no limitations with dorsiflexion or plantar flexion. They had no previous trauma with a calf or ankle previously. And they had no lower extremity dysfunction observed by gait training, no surgeries, anything like that. There were 54 women, there were 35 men, and the ages ranged between 20 and 60 years old. Other studies have been previously done before. 6 of those studies actually proved that there was very slight, minimal range of motion after doing gastrodynamic stretches. They ranged for anywhere from 1 to 1.7, 1.8 in most of those stretches. Six of those studies were done with a wall stretch. One was done with a pulley system laying on the table, and the third one was done actively. So again, the stretches, they're going to do a wall stretch. Previously, what they had done was they had them just their feet 2 or 3 feet away from the wall, and then with their back leg straight and their knee extended against the wall, flexing and stretching out that back gastrocnemic muscle. And then what these guys did was they had them stand further back against the wall until they felt a substantial pull on that calf muscle, but not necessarily a painful muscle. And then once they did all these stretches for the periods of time that they had them do, they did a gonimetric before and after. That way they can find out the range of motion prior to the stretches and then after as well. And the way they did those gonimetric measurements afterwards and before was they had them prone on a plantar table, their right knee extended and their foot hanging off the table. They did active range of motion, dorsiflexion and plantar flexion 4 times, up and down, before they did the range of motion. That way it softened up the tissue. That way you can get an accurate range of motion reading. They were broken up. They sent out an ad for anybody who wanted to do the healthy adults. It was an ad anywhere in the it was an ad on the paper. They put it online anywhere that anybody could do it if they wanted to. They just had to meet these qualifications. They answered a questionnaire and they put them find out their activity levels. That way they can determine if they were very active down to barely active. But it didn't have any groupings. It didn't have a factor in any of the groupings, and they grouped them from groups 1 to 4. The first group was a control group, which just did 1 stretch daily, and then group 2 did that stretch 5 times a week for 30 seconds. Group 3 did it for 1 minute 5 times a week, and then group 4 did it for 60 seconds 5 times a week, and they would determine, again, if doing those stretches did increase after 6 weeks, increased the range of motion of dorsiflexion in the ankle. Some of the results, this is the results compared. They did it by group, so you can see that the range of motion varied between the control group and the group who did it for 30 seconds, then the group who did it for 1 minute, and the group who did it for 2 minutes. And then another result was, this is just a sporadic group. They didn't break it up to any, but this just shows you the change in range of motion. On the left is the change up, positive or negative range of motion, and on the bottom here was the pre-treatment, and that was the post-treatment. And it shows you the change if they went up or down from the stretches after the period of time. And in this one, they broke this chart down by age to determine if maybe an age factor came into play, about if it stretched out for the youngers or 60, or if you're up to 60 years in age, if the age had a factor, and if the range of motion increased with the stretches. Again, they didn't place them in groups by age, they just put them in random grouping, but they just broke them up into this chart. They broke them up into the ages to determine if this was one of the factors that could increase the changes. They did have a hypothesis before they did the whole test to find out that they thought that the further you stretched it, the longer you stretched it, the increase in range of motion you would have. But the results came out that they were unable to demonstrate after 6 weeks of stretching of the calf muscle tendon unit in non-paired adults that that effective stretching increased active dorsiflexion range of motion rather than no stretching at all. Even though the stretching guidelines have been successful in increasing flexibility of hamstring muscles in adults, it did not have any effects of stretching the gastric muscle. That it did not have an effect on an increase in active dorsiflexion range of motion. They would like to do more results or more tests, and what they would do next time is that they would do it with impaired patients to find out if that one did have an effect on range of motion, since all the tests previously have been done on healthy, unimpaired results. So that is my presentation on if stretching the gastrocnemius muscles would increase your dorsiflexion range of motion.